Watch this video before getting a hip or knee replacement. My name is Marcelo González. I'm one of the physicians here at RMI. Orthrophic is the new treatment we're going to be doing in RMI. We want to treat arthritis, give your joint more time before you have to do a replacement, reduce the pain, allow more mobility. This treatment is so special because it's the first treatment that non-surgically can regenerate cartilage. In long-term follow-ups at 2 years, they've seen an increase of 2 to 3% in the cartilage thickness. So I know 2 to 3% doesn't sound as much, but for us to not only preserve the cartilage for 2 years, but actually don't see a decline and actually get a more thickness is amazing, okay? There is no treatment in the world that can do that. And for a minimally invasive, non-surgical treatment, it's very exciting for us. From 50 to 70 years old, you're losing about 15% of your stem cells in the subchondral bone. Every joint is made up of 2 bones that meet each other. When they meet each other, they have a cartilage lining. That cartilage is a very delicate structure. It doesn't have any arteries or veins coming directly into it, and it uses the subchondral bone, which is inside the bone. That part of the bone gives the nutrients to the cartilage. When you have arthritis, when you have a worn joint, you usually have that subchondral bone damaged. It stops giving all the nutrients that the cartilage needs. The main goal of Orthrophic is to put stem cells directly into the joint, in the intra-articular space, and into the subchondral bone for those two to start nurturing again the cartilage and giving it more time for it to regenerate and more time for you to have your own joint. This treatment's been going on, it's been done for around 20 to 25 years. There is long-term studies of up to 15 years. They've seen that people that needed a joint replacement right now, in the 15-year follow-up, only 20% of those patients needed a joint replacement. It delayed the surgery for 3, 4, 5, 8 years. Okay, so if we can give that joint a year, 2 years, 3, 4, up to 15 years, it's going to be a great thing for the patient. It's going to be a great thing for us. First, we'll have a virtual consultation, get to know you, get your past medical history. In general, how bad is the pain and what we can do for you. We usually review MRI and X-ray just to make sure that we can treat what you have and just to confirm that you actually have an arthritis that we can treat. Once we figure that out, we're going to be scheduling your visit here to Costa Rica. We have a patient experience team that's going to handle pretty much everything. Once you're here in the clinic, we're going to take you into the surgical room. We have an experienced anesthesiologist there that's going to be sedating you. The sedation is just a light sedation since the treatments usually last around 30 to 45 minutes and you won't feel any pain there. What we do is we pretty much go into the 3 bones of the knee and the 2 bones of the hip. The idea is to go into the bone, into the femur, into the tibia, into the patella, and into the joint. We're going to be distributing a bunch of cells all around the joint to try and get everywhere. And we use ultrasound to guide the needles that are going to be going into the joint. That is just to make it a lot safer for you and prevent any complications. Once we finish the treatment, we'll take you into the recovery room. We'll just wear off the anesthesia. Once it's worn off, we're going to take you back to the hotel. That day, you are going to be able to walk around, and we're going to ask you to have partial weight bearing, okay? That's just for the first 2 days. It's going to hurt a little bit, but we're going to give you some medication, and we have an on-call team in case it's needed. Usually by day 2, pain is almost gone. We like our patients after the first week to start with some workouts, to start with some exercise, because the joints just like it that way, okay? The first week you have to slow down in order to the second week to go a little bit faster. There's thousands and thousands of knee replacements and hip replacements all around the world. With this treatment, we might not only be delaying this treatment, but maybe even not even getting it. A knee replacement is very expensive. This treatment is way less expensive than a knee replacement, and it can take you through 15, 20 years of not needing a knee replacement. Only that is very exciting. For it to have very good results and very low complications, the expenses you will have are way lower. It's very encouraging for us to help patients in a different way, in a safer way, to actually use their own joints to stay there for a longer time and not have to put metal and plastic for it to be worn over time. What makes us excited about it is that we want to make it a mainstream thing. We're going to make it that people are not afraid of getting stem cells, that people know what stem cells are doing to their joints, because it's a very good thing. Studies all around the world have proven this, and we want to share with our patients.